Mr. Chairman, ministers of government, honorable members of parliament, members of the diplomatic and consular corps, our development partners, the mayors, chairmen and councillors of our local governments, our traditional and religious leaders, members of the NGOs, civil society, and other institutional representatives, ladies and gentlemen. It is a great honor for me to be in your midst today to launch the service level agreement. This is a historic moment for service delivery in Sierra Leone. The Ebola virus disease put to great test our service delivery system and expose gaps that we need to address. Lack of effective coordination between government and our partners in the sector is amongst the most significant gaps. The service level agreement is being launched to bridge the gap, enhance transparency in the partnership, and ensure effective service delivery for our people. Today, with support from our partners, we are at the brink of winning the fight against Ebola. We now have a better understanding of the epidemic than we had almost a year ago. Sure. We also have more capacity to fight back than we did at the beginning. But we are not yet out of the woods. Ebola eradication needs 100% success rate. A single individual with the virus means that all 6 million Sierra Leoneans are not yet out of the woods. A very small number of our people are still engaged in behavior that is putting all 6 million of us in great difficulties. But we shall not rest until everybody acts in accordance with the messages that are all over the country. Do not touch the sick. Call Ebola response workers in case of sickness and death. They are trained to handle it. This message is all over the country, in every village, but we still have our people doing the wrong things. And yet we cannot rest until the last case is removed from our country. My government has developed a comprehensive and implementable recovery plan. My office is happy with the collaboration with the sector-specific delivery teams. It is my hope that the spirit of commitment displayed so far will be sustained beyond the 9 months and continue until we re-engage with our agenda for prosperity. For the health sector, we want to immediately ensure that the facilities will guarantee a safety for the health workers and also the patients, and ensure that the essential health services are restored almost immediately. We applaud our partners for supporting us during this very difficult period. However, it has been the case of lack of coordination amongst government and the partners that has been of a great challenge. We have major donors in the health sector who are providing smart investments. Donors like DFID, Gavi, Global Fund, African Development Bank, the World Bank, the EU, the United States, China, AU, Nigeria, and many others are investing in the health sector, and there is a great determination on them to increase their investment. We have made progress, no doubt, in the health sector. But I often ask myself, with all of these investments, with all of the players in the health sector, why is it that we are still struggling to get the desired health outcomes for our people? Let us take a step back and look at the numbers in the health sector. In terms of the civil servants, they constitute more than a third of the total civil service workforce in this country. In terms of the NGOs, civil societies involved, more than half of the civil societies, NGOs, and other players are in the health sector. The donors active in the country, almost all of them are providing support in the health sector. We now have the local government players involved in the health sector. In terms of investment coming in, the figures of support provided for this country, almost a similar percentage goes to the health sector. But why have we not achieved as much as is expected? One of the reasons, I'm not saying it's the total, is because there is no coordination. Before now, it is a sector for everybody's initiative to be driven.
Thank you.
Ministry of Health do not know what is happening in the field, what is being implemented by NGO X, NGO Y. Even out in the field amongst NGOs, there is no coordination. Everybody is doing his thing. That is why we have not created that impact. That is why the quality of the health service has not improved. This must stop. Ebola has created an opportunity for us to have a new beginning in our engagement in the health sector. And the SLA will provide the basis for it. We have been presented with an outline of the SLA. It makes sense for us to coordinate, to collaborate. It makes sense for us to monitor the implementation of our programs. We have had similar situations in the past, but because of the need for us to deliver now, we are going to ensure that we adhere to the provisions of the SLA to the letter.
Thank you, sir.
We have been subscribers to all of the international engagement agreements onto the New Deal. And we have to adhere to the provisions of the New Deal. Before now, the donors or the partners will say that I don't trust the people in the Ministry of Health. They lack the integrity and the capacity to implement. So I'll rather do it alone and report to my partners. The Ministry of Health have a responsibility to develop both the capacity and the transparency within. Because we cannot continue business as usual. As a government, we have agreed on our priorities. In developing our priorities, we have involved everybody, including the partners. so that there will be collaboration at that point. And if we have collaborated in developing our priorities, we must continue the collaboration. That is why now I'm satisfied with what is going on in my office in terms of the preparatory work. I'm satisfied with the collaboration that is going on. And now that we're coming to launch the SLA, we must continue that collaboration from now moving forward. That is the only way we can ensure that the quality of service is improved. That is the only way we can guarantee transparency and accountability. So therefore, I will urge everybody here to adhere to the letter, the provisions of the SLA. Where we need to modify the provisions based on the experience on the ground when it comes to implementation, then we can come together and make the modifications. But let it be focused on improving on the quality of service and benefit for our people. At the end of the day, the statistics are not looking good. Before Ebola, we made efforts. But with Ebola now, the statistics are terrible. So it is our responsibility, all of us, to come together and rise to the occasion. I have given specific instructions to the minister to ensure that regular updates on the implementation is provided by my office. So if we have to be part of the monitoring process, I will not mind to get out of my office to go to Kailam to ensure that we implement. Or go to Bong or Koinadugu district. But we must make a difference. Yeah. We must make a difference in the lives of our people. Sure. With those remarks, it is now my singular honor to launch the SLA agreement with the hope that it will be implemented to the letter. Thank you very much for your attention.
See the good ones.